everybody. My name is Marie Kilduff, Interim Director of the National Clinical Leadership Centre for Nursing and Midwifery, Office of the Nursing and Midwifery Services Director in the HSC. I'm delighted to welcome you all today to our 5th webinar in our series, and this webinar is entitled Nursing and Midwifery Clinical Leadership During COVID-19, Sharing the Learning from Acute Nursing Services. Our panel today consists of Ms. Áine Lynch, Director of Nursing, Tallaght University Hospital, Ms. Kate Brennan, who at the time of submission was a 4th-year general nursing student in Tallaght University Hospital and Trinity College, Dublin, Ms. Sinead Horgan, Group Assistant Director of Nursing for Sepsis, Flu and Surgical Site Infection Surveillance for the South-Southwest Hospital Group, and Ms. Áine Gilligan, Assistant Director of Nursing, Critical Care Services, St James's Hospital. You're all extremely welcome here today and thank you for taking the time to join us. I'm going to start with Ms. Áine Lynch. As I said, Áine is the Director of Nursing in Tallaght University Hospital. Áine, you're very welcome here today. And my first question to Áine is really in relation to COVID, Áine, being the director of a very large hospital for acute services, I'm just really interested to know, how did you mobilise your nursing team and all of the TUH staff to respond to the pandemic?
Thank you, Marie, for giving me this opportunity. And I'd like to say at the outset that the nursing response in Tallaght University Hospital was absolutely exceptional, like all my colleagues nationally in terms of the pandemic. We had been looking at what was happening in Italy and Spain, and under the expert leadership of Lucy Nugent, our CEO, we had begun to plan really from late January for what was to come, along with my own senior executive management team of assistant directors of nursing and CNM3. We were meeting on a weekly basis, I suppose, in the first instance, and that moved very quickly to a daily basis. In terms of big picture, we needed to look at our critical care, we needed to look at our ED environment, our immunosuppressed patients, our older population, and indeed all our inpatient ward areas, who were now expecting a very different profile of patients who we anticipated would be presenting in a fast and furious manner based on data that we had seen elsewhere. We also had to look at our scheduled care. So in terms of our, we really moved from scheduled surgery to time sensitive and emergency only. Our outpatient activity, we ceased bringing patients and families on site, and we moved to a virtual platform, or reaching out to patients and keeping patients healthy at home. And many of our advanced nurse practitioners and our clinical nurse specialists were instrumental in that regard, including a number of our Sláinte Care projects. We needed to look at our, I suppose, in terms of the, we also needed to look very quickly at our infection prevention and control nursing team. So we augmented that with additional colleagues. We augmented our palliative care team. We augmented our occupational health and well-being team. And then my own colleagues of ADoNs and CNM3s, we moved very quickly to a 7-day roster pattern. So we maintained a kind of a presence over a 12-hour shift plus weekends. So just again to maintain, I suppose, high visibility, touching base, making sure that you had senior nursing leadership on site to support all of our colleagues of all grades, our staff nurses, our clinical nurse managers, etc. So that was very, very important to have that visibility at all times.
I know, and just as you're presenting there, I'm just really conscious of the amount of organisation and planning that went into all of the work that you and your colleagues did in Tallaght University Hospital. I'm just interested to know, as part of the planning, what areas did you actually prioritise in the midst of this evolving crisis?
Okay, so we looked at, I suppose, number one, our access into the hospital. So ED, we needed to create a COVID and a non-COVID pathway, and colleagues in CHI facilitated us with an additional footprint for a defined period of time, which really worked well for us in terms of having that additional space to create those pathways. CHI also facilitated us with some inpatient areas temporarily, and we were able to move our immunocompromised hematology oncology patients into one of the children's ward, which was really fantastic. So that allowed us to separate that very vulnerable group from the general population of the hospital, if you like. In terms of critical care, we looked closely at our nurse staffing and all our staffing in critical care, and because we were limited in the number of critical care beds that we had, we planned to move into our recovery anaesthetic area and indeed our theatres. So our theatre colleagues, recovery anaesthetic nursing staff, and staff who had worked in ICU previously, staff from coronary care, staff from CHI, all came together as part of a blended team to work with our nurse experts in the ICU proper as such, to provide care to a kind of a larger cohort of patients, because we did spill over beyond our current ICU capacity. Then in terms of our hematology daycare patients, again, another group that come into the hospital all the time for their chemotherapy treatment, with the support of colleagues in TCD, we moved the whole oncology day ward off-site into the Russell building, which is a TCD facility about 500 metres from the hospital. So literally bag and baggage over a weekend, we moved the entire suite off-site. So again, a huge dedication by the nursing team and by all my executive colleagues, such as ICT, facilities and estates, etc. So really, as I'm sure happened in other places, things happened at the speed of light that normally would have taken, lots of negotiation and many conversations. Really, things happened very, very quickly in order to prepare for what was to come.
Absolutely, Áine, and the responsiveness is so admirable, I have to say. And I think it's probably because everything was happening so quickly, as you said, that you just had to just think on your feet effectively. There was so much you did so well, and you've spoken to that. I'm just thinking though, unfortunately, Áine, we're in a second wave currently, and in a way, we're kind of facing a similar situation again, but this time we've almost lived through it already. And I'm just wondering, from your experience, is there anything different you would consider doing, or is there anything you'd focus on with the benefit of hindsight of having led in the first wave?
I suppose in the first wave, Marie, it was all hands on deck, and because a lot of our regular activity was minimised, it allowed everyone came together and focused entirely on the patients that presented to themselves. So I have to acknowledge again, staff at ward level, my staff colleagues in education, in nurse practice development, there was ongoing education to prepare staff for patients who required NIV, etc. That maybe certain ward areas wouldn't have been familiar with, etc. So we had advanced nurse practitioners, we had clinical nurse specialists. Everyone came on and worked with our ward staff to support care at ward level. I suppose this time around it's very different. It's disappointing that we're here again, obviously. It's very different because now we are trying to continue with some of our regular activity, so everyone is tied up in doing that. So that is posing a challenge for us. The other learning, or I suppose something that I personally worry about, is that we still our visiting restrictions continue, and we know why that has to happen, and the evidence is there, and obviously community transmission is an issue, but I suppose I am concerned around, we have many vulnerable patients who possibly have been in hospital for a period of time, and really in terms of their recovery and having that, family comfort them and support them, and it is part of their healing process. That is an issue. That is something I'm concerned about, and we certainly have put in, we are using technology to reach out to families. We are working around scheduled phone calls with families. We have a patient care package where we've actually processed 10,000 care packs that families bring in for their inpatients, so since March. So I think that's remarkable. We have a Sending Love initiative, but I suppose nothing meets or nothing really is the same as having a family member come and spend time with a loved one who's in hospital. So that's something that I suppose we're looking at, how can we do better in this regard.
And Áine, just to say, I think what you've learned obviously is really clearly benefiting in terms of the way you're thinking now, and certainly in terms of families. Yeah, it's really, really difficult. We know from other webinars and from speaking to people in colleagues, etc., and even people we know, it's just so difficult not to be able to visit a loved one in hospital. Áine, I suppose I don't want to lose an opportunity. We have a very senior director of nursing and yourself here presenting today, and there'll be many, many nurses listening to this, and indeed we may have some midwifery colleagues as well. And I'm just thinking, in your position as a very senior nursing leader, is there any message from your experience that you feel would benefit nurses listening to this webinar today?
I suppose two key messages, I think, Marie. Number one is I want to acknowledge again the huge leadership shown by all grades of nursing and indeed healthcare assistant staff. And I know that Kate will be talking to you shortly, but I would like to acknowledge the leadership shown by our internship students and by colleagues of all grades, and the value add that had in terms of I suppose trying to maintain, excellent standards of patient care at a very difficult time for us all. So I would like to acknowledge that, and again, people doing lots of innovative things, like one of my colleagues established a drive-through anticoagulation clinic. That's just one small example of, patients who were very nervous about coming into hospital. So she would have met them in the car park and managed it, through a car window. So, there was huge innovation. And as Dr. Mike Ryan said, it mightn't have been perfect on day one. It was all about doing the right thing, doing a good thing, and then getting the perfection afterwards. Secondly, I would like to say, I suppose it's something I felt very strongly about. People were continued to come to work throughout the pandemic. Really took ownership of all the challenges at home around childcare, etc. Schools closed, everything, older parents, etc. My nursing colleagues really, continue to come to work, took ownership of their arrangements, were completely dedicated to providing care for patients and reaching out to families. And I suppose in terms of, I was very open about talking about people minding their mental health, switching off from social media, getting out in nature, listening to podcasts, doing yoga online, etc. And it's something that I try to introduce into all my conversations. How are you doing? How are you feeling? How are the family? We did have psychology online. We established that in Tallaght University Hospital with our psychology colleagues. So I suppose it's something, this continues. It's not going away. If you work in healthcare, it's a very intense environment, and we have families at home to consider. So I suppose that was a key message for me to look out for each other and to look out for everyone's health and well-being, and to be mindful, I suppose, of minding yourself and staying healthy.
Áine, thank you so much for all of your answers. I think the final key messages are so important, and it's really fantastic to see yourself as an authentic leader being so open and honest about speaking about how everyone's feeling, which is key at this time. So I wish you the very best as you move on into and managing COVID going forward, and thank you so much for joining us today. So now going to move on to our second panellist, who is, as I've said, Miss Kate Brennan. And at the time of submission, Kate was a fourth-year student nurse in Tallaght University Hospital and in Trinity College Dublin. But firstly, I'd just like to congratulate Kate, because she's since graduated as a registered general nurse. And in having Kate and Áine here today, we are really showcasing the board toward scenario. So it's an absolute pleasure to have you here today, Kate. I'm really interested to hear of your experience, as I'm sure our listeners are. And I suppose my first question is, as an intern during the time of COVID, what was your unique role during the outbreak?
Absolutely, and I just want to say thank you so much for having me. It's lovely to be given the opportunity to share my experience. So I suppose to start off, like, being an intern in itself is such a unique experience. You are the most junior member of the nursing staff on the ward, but you're also working at such an independent level. So it's quite an interesting kind of threshold to be at in your career anyway. On a personal level, the kind of primary emotion, I was very worried. I was very afraid working in this environment, and we heard all the stories and we heard all the news coming out. We all have vulnerable people that we love, that we would hate to expose to this virus. So on a personal level, it was very tough. at the beginning. On a professional level, you know, my colleagues included, you know, we were so worried about coming out of this as kind of confident and competent nurses. We were worried, would we, you know, achieve our learning outcomes? Would this be an environment of learning? So I suppose that was kind of the initial shock factor of it all. But then I suppose, you know, the role of the intern is, and always will be, you know, to look after patients and to provide care to your patients. So I suppose with this situation, we had to be a bit more adaptable. We had to learn to prioritize care a bit more, and to kind of let go of this need to be perfect, and instead kind of fill it with this attitude of collaboration and genuine caring, and to do your best, and to, you know, be present and be supportive to your patient during this time for them. And I suppose that's kind of what I took away from it, that it was a very new experience, but I suppose I was at that unique place where, you know, being independently working was a unique experience. So I suppose I was a little bit more adaptable in that sense. But yeah, it was an interesting situation to find yourself in kind of so early on in your nursing career.
Absolutely, Kate. A very unique position, I think, to find yourself in an unprecedented situation. Yeah. And you spoke about the personal fear, which is so real, and the professional fear as well. And I'm interested to know, how did your training prior to the pandemic prepare you for this situation?
Yeah, absolutely. Like, we came out, so we were just from our Christmas exams, and we had maybe kind of 8 to 10 weeks of internship behind us when we started kind of working with COVID patients. So we'd come from a background of academia anyway. So I suppose we were so used to applying kind of evidence-based research to what we were doing. So I find in a way that helped us, because we were like sponges, you know, we were eager to learn, and we were so used to learning that I think that helped us, because, you know, daily there was updates, and there was different treatment plans and different, you know, medication and all this that was coming out. So we were so used to applying that to our nursing care. And I suppose also, you know, we were running on adrenaline. Like, we were so eager to prove ourselves. You know, we had spent 4 years kind of revving up, and then we were ready to go. So I think that adrenaline kind of got us through it. And it was kind of something that we could use in those hard times. We kind of could dig deep, because we were so used to kind of being challenged at work and feeling a little bit overwhelmed and feeling a bit out of our depths. So I suppose that kind of played part and parcel to then our role in the team, you know, during the pandemic.
Absolutely, Kate. And I suppose, you know, as we've spoken ourselves before this webinar, this is obviously a leadership webinar series, and we've both agreed, like, clinical leadership is applicable to everybody at all grades in healthcare. I suppose I'm interested to know, like, from your perspective in your role at that time, how important and evident was good leadership at the time of the pandemic for you?
Of course, you know, as a student, you know, you're constantly observing. So we were constantly learning from the staff nurses that we were with, and we were constantly observing them. So we definitely found, you know, evidence of leadership through that. You know, in my opinion, you know, kindness is such an important factor of leadership. And the staff nurse that I admired were the ones that, you know, didn't let this situation turn them cold or harsh towards their patients. They were the nurses that could still manage, you know, kindness and empathy and, you know, a sense of humor sometimes, you know, when appropriate towards the whole thing. And they were the nurses that I looked up to, and I said, you know, I want to be like them. So I suppose that was one thing that I really took away from it. And I suppose also advocating for the patients. You know, these patients were so vulnerable, they were so isolated, so you were their voice a lot of the time. So by seeing the staff nurse do that, you know, it gave me that example. And also, as far as emotional health, you know, to see your senior member of staff struggling, it also kind of normalized my struggling, and it made me realize that it was okay if I was feeling upset or low, because it was kind of that attitude of we're all in this together, and it very much is what it is. So I think, you know, showing that vulnerability as a professional, you know, I think there's something very kind of empowering about that, because it gave others the courage to be like, yeah, this is really tough, but we can do this.
And I think, Kate, what's really refreshing to hear and really important as well is your observation of compassionate leadership and authentic leadership, so that you saw that kindness and caring nature of people, and also then the authenticity to be able to admit when things are tough, no matter what grade you're at, which really seemed to help you. Kate, you're also in a great position here today to, to actually give a message to people who may be listening, who may be students themselves, people may be listening who have family who want to go into the profession of nursing or midwifery, but may be a little bit afraid, or the students listening may be a little bit challenged because of what they're going through. Can you tell me what you'd like to say to them from your own experience?
Yeah, I mean, my heart does go out to them. COVID is a traumatic, awful, senseless thing that just happened. So I understand people's apprehension, to come into this career. I really do. But I suppose kind of my thinking of it is that even though this time is tentative and fragile and, so scary, I think caring for patients is always worthwhile and it's never wasted. And I suppose we don't always get a say in the journey of our patients or where we meet them on that journey, but we do get a say in who we are to them and how we behave. And I think there is such a sense of empowerment that comes with that, and such a sense of purpose. And I suppose that's how I came out of this situation, feeling like I don't have a say in the chaos around me, but I have a say in who I am. And I really do think that if you have that kind of genuine interest in people and a big heart, I do think that nursing is a very, it's a remarkable profession. It's an absolute privilege to care for people and to help people, in their time of need. It really is. And it fills me with a great sense of purpose. So I suppose my advice to the students in it, you've come this far, don't go this far to only go this far. It's as tempting as it is to kind of run away from it all and close your doors. I think you really do owe it to yourself, and you're much stronger than you think. And, I heard a lovely quote the other day, and it goes something like, courage is not the absence of fear. It's going on because something might be more important than fear. And I suppose for me, that's how I kind of got through it, and I'm getting through it. So advice wise, I think, I'm a talker. I really believe in talking. I was very lucky. I had my mum, she's a nurse. So I could talk to her, every day coming home from a shift, I'd call her and I would just let it all out. CPCs on the ward. I had a great CPC, Yvonne. She was always there for me. She always knew how to make me feel better. They know they're in it with you. They're in the trenches with you. So reach out to them. I think also college-wise, from Trinity College where I studied, they have specialised counsellors trained to speak to healthcare students. So please never feel that your problems are so unique and they're so niche that no one understands. They have nurses that have become counsellors that are there for you to talk to. Because they know healthcare students kind of have a more unique kind of needs, just with the, with kind of the population, the environment they're in. I suppose what also helped me was journaling. I have my COVID journals. I wrote a page a day after every shift just to get it out, because I suppose, if there's something kind of eating away at you, you have to find a way to get it out. And if you can't feel like you can talk about it, you can say it to a piece of paper, and it kind of takes the power out of it, and it gives you that sense of, doesn't really belong to you anymore. So I think that really helped me. Even if you're not a writer, I think even just scribbling it down, it certainly made me feel better. And I suppose then, as far as just generalized advice, have your things outside of nursing that make you and that make you happy. And, whether that's a walk with your friend, having a nice lunch to look forward to, your FaceTime, your FaceTime hangouts with the girls, have those things, have that list ready for when that emotional crisis kind of hits, that you have these foolproof things that make you happy. Because I think, you have to find some happiness in all of this, because COVID's here, unfortunately. COVID never really left, but I think you do have to find a way to detach from it and to be yourself and to find happiness and peace in that, in spite of it all.
Kate, thank you so much. I think that's a fantastic message for everybody listening, and even for ourselves. So thank you for taking the time to join us today, Kate. And it's been lovely having both leaders from the same site. So thank you to both yourself and Áine. I'm now going to move on to our third panellist. And our third panellist today is Ms. Sinead Horgan, who is, as I said, the Group ADoN for Sepsis, Flu and Surgical Site Infection Surveillance for the South-Southwest Hospital Group. Sinead, you're extremely welcome today. And I'm going to start really, Sinead, with your title, because I'm just looking at the title thinking you were key in relation to COVID and the pandemic. And I'm really interested to know if you could tell us about how your role changed during the pandemic when it evolved.
Thanks, Marie. First of all, thanks very much for having me and giving the opportunity to speak to you today. I suppose, like everybody back in March, I was redeployed to open and run a COVID swabbing centre for the South-Southwest Hospital Group, and that we were swabbing staff from both the CHO area and the acute hospitals. We were also swabbing patients that were symptomatic, like CFs, particular cohorts of patients. And then we were just moving into the realm of doing pre-procedure patients, which we're still doing to this day. But back in April, a local community hospital ran into a fraud situation where they had a COVID outbreak, which affected both their residents and the staff. So there was a huge sick leave rate there. So the community healthcare organisation, in collaboration with the South-Southwest Hospital Group, came together and they did this response initiative where they would send in a team, and I led that team into the community hospital to assist in with the outbreak, and became a member of the outbreak management team. And it involved bringing actually 33 nurses into for a 2-week period to cover 62 shifts, night and day shifts, to assist our colleagues in the community hospital. So, yeah.
It sounds like a very challenging task, Sinead, and I suppose I'm interested to know, how were staff from the acute hospitals encouraged to redeploy to the community setting?
I suppose at the time, if you remember, because each site were reducing admissions, elective admissions, and there was scope there. So the Chief Director of Nursing, Ms. Bridie O'Sullivan, for the South-Southwest Hospital Group, engaged with her Director of Nursing colleagues, and she informed them of the situation, and that started the process going. Then I visited the site and I met with the General Manager of the CHO area and the Director of Nursing. So then from that point on, it was all of those, and I caution around redeployed at the time. Initially, it felt like redeployed, but they were just such an amazing group of nurses, leaders in themselves, that it was nearly volunteering to assist at this fraud time. So that having the knowledge about what was going on, and being able to talk to them on the phone, engage with them and explain what was going on, they were more than willing to assist at that time. So it was more like volunteering than redeployment, to be honest. Yes.
And, you know, I think we've heard so much of the very goodwill of staff during COVID, and with our webinars as well previously, Sinead. It's really fantastic that staff are so willing to actually be so adaptable and agile at a really serious time of crisis. I'm sure it took a huge amount of planning. And could you tell us about the planning considerations that were there to organise this initiative?
The planning, I wouldn't have foreseen the amount of planning at the time, but it grew. So there was like these staff that assisted at this time. They were all within 100 to 150 miles away from the community hospital. So even that alone meant there was accommodation considerations, meals. There was actually being able to communicate with them that there was uniforms on site. I was doing the off duty for the 2-week period, marrying up those that may be returning to work from the community hospital. So it was actually over the 4 units that we were working in. It was just that organising. It was down from, as you remember at the time, uniforms, PPE, showering, you know, all of those logistics that are necessary, separate changing areas for each unit, separate access areas into each unit. And that reassurance for the staff was very important at the time, as well as the PPE elements as well. So there was a lot to consider: accommodation, you know, travel. There was just so much. I suppose the key thing for me, I suppose, was the WhatsApp group. Where were we before WhatsApp? The ability to communicate, to feed information constantly. So I set up that WhatsApp group. In actual fact, nobody has left it, even though we haven't used it. So there is the level. So even maps to the accommodation, you know, and of course I met each person as they arrived on shift, night or day, showed them around, guided them. And I think that was crucial for the smooth running. It's not only just the planning and the organising, but can I just say, the welcome from the community hospital was overwhelming. They were just so kind and welcoming to everybody that it actually was humbling, really, to be honest. Yeah.
It's fantastic to hear about the collaboration there and
Yes.
the use of social media to connect, really,
Yes.
and to support each other during that time. Sinead, what you're describing is just reminding me, I suppose, I'm just thinking about Sláinte Care, and really it's the integration between the acute and community services, and you're giving us a glimpse as to what that will look like with the vision for the future of healthcare in Ireland. I'm just wondering, from a learning perspective, what would you say was the key learning from your experience that we could use in the future, really, for initiatives like this?
Yeah, it's interesting. I thought of Sláinte Care all the time while I was down there. I suppose last year, the year before, we were going, how is that going to work? How is Sláinte Care going to work? But with very short lead-in time, it just worked so well. It just happened. It just organically. It just evolved. Just, I suppose, both groups have a common purpose, a common mission statement, and that was very obvious. It was the patient, it was the care, it was the mission statement of the HSE, I suppose. But I was just blown away at how well it worked, really. You had people who had never worked together before, all working together. I suppose for me and for everybody else that worked there at the time, common consensus was that what we did working with our community colleagues was very special, and we'd remember it actually to the day we retire and beyond, and that we knew we were part of something special, and we made I suppose friendships there, and we found new respect, I suppose, because I suppose we constantly look at community and acutes, but you have this level of expertise in the community hospitals that is actually phenomenal, really. We learned as much from them, even though they were treating us as experts, and we were part of the outbreak team and that, but all of us felt we learned so much from them. One of the key things for me, if it was to occur again, would be, I would think, remembering back in April when we were getting updates every day from the health protection, and we had different PPEs, and it was realizing the cohort of patients that you're minding, matching the PPE to that, and realizing that that's okay. You know, you remember back in April, there was FP2 masks, huge around that. But now we all have that. We know who we should listen to, the Health Protection Surveillance Centre, and we keep updated with as it comes on board, the knowledge comes on board. So that was it, really. That's my taking from it.
Sinead, thank you so much. I think you've eloquently presented your experience of this initiative, and I think really, you know, it's fantastic to hear how well it went, the collaboration and the huge learning from, you know, community and acute working together for the common good of the patient, which at the end of the day is what we're all working towards. I think you've given us a fantastic glimpse into Sláinte Care and the future of healthcare, and that's certainly the right way to go. So thank you, Sinead. Our fourth panellist today is Ms. Áine Lynch, who, as I said earlier, is an Assistant Director of Nursing and Critical Care Services in St James's Hospital. Áine, you're extremely welcome to our panel today, and I'm really interested to hear about your experience, because I suppose in your submission to participate in the webinar, you referred to the positive impact of clear purpose within and beyond critical care. And I'm really interested, and I'm sure our listeners will be as well, to hear what you meant by that.
First of all, I'd like to say thank you very much for the invitation. I'm delighted to present our experience here in critical care in St James's Hospital. I suppose, as indicated by previous speakers, we all observed the overwhelming impact that COVID had internationally, and the harrowing scenes that occurred in critical care, for example, in Italy, whereby they ran out of critical care beds and oxygen to provide, you know, safe care to patients. And really, on review of that, as a team, our purpose was clear. we were determined that no critical care patient would be left behind. And this, I suppose, in essence, really focused our minds on what we needed to do, how we needed to do it, who needs to be involved, and the process of rolling it out. And for us as a team, preparedness was key. And we realized that we needed to reimagine our workplace in such unprecedented times. We really focused on a few main elements, particularly capability and capacity. In relation to capacity, we created a 6-point surge plan, which really quadrupled our critical care capacity. And we had to rethink of how we were going to provide, ICU beds to so many patients should they require them. And we were very fortunate at the same time that the government also provided a change in care, and acute patients and acute surgery was moved to private hospitals. So we were able to transform, say, the cardiothoracic intensive care and the cardiothoracic ward into COVID ICU beds. And the CCU was relocated. So we really had buy-in from lots of elements within the hospital and within the HSE and nationally to facilitate this change and to facilitate us increasing our capacity. And in relation to capabilities, we really needed to look at things like equipment and personnel. So we formed many subgroups. So initially we started off, we formed a critical care coordinators group whereby there was nursing care available Monday through to Sunday. And these were nurse leaders who were available to guide and support the various critical care ICU teams within the hospital. And then we also formed various subgroups. We would have liaised very closely with the clinical lead, and really aspects of the hospital throughout the hospital were involved. For example, procurement, medical physics, and really I can't think of any department that wasn't involved in the buy-in of us preparedness. And I know that one of the engineers commented to me that the amount of work that we did in 2 weeks was the equivalent of 2 years' work. And I know some equipment would have been ordered at midnight on a Saturday night. So people really pulled out, and there was very much a can-do attitude. And in relation to personnel, we set up workshops for any interested healthcare workers, ideally those who had previously worked in ICU, but any other interested personnel could attend. And we ran several workshops per day, which were practical, interactive workshops, focusing on to give people some insight and into the core elements of critical care and providing appropriate care to these patients. But then with time, we had to move on virtually, and we created, we had electronic educational packages. And then I suppose as the surge increased quite quickly, we would provide one-to-one support for nurses, healthcare workers, and various personnel such as physiotherapists and other, not doctors who wouldn't have previously worked in ICU, who all came to help, and they were all part of the care. So we really optimized our capability and our capacity through all of these elements. And I suppose the fact that we were all driven as to why we needed to work together, it was really amazing to see how that impacted and it delivered on the ground.
Áine, thank you so much. And as you present there, I'm just really, really in awe of the huge amount that was done, like everywhere else, in such a short period of time. And as you said, like to have that common vision and goal really helped, and the goodwill and the buy-in and the collaboration and everybody working together. I think ICUs, and we've seen it time and time again in the last 7 or 8 months, they've just really featured in terms of the care of COVID patients, because ultimately some will end up in ICU, and we've seen it internationally. And I'm just wondering, if you could tell us about what was your greatest challenge that COVID-19 presented to you and your team.
Well, in these unprecedented times, really several challenges emerged. I suppose the volume of staff absences we couldn't have anticipated, and that was significant for the day-to-day running. And I suppose everybody just corralled together and worked together with the team that we had available. And as say the critical care coordinators would have reviewed and try and optimize. And our priority at the end of the day was the patients got safe care. So you would really review and do what you could within the resources that you had. And the impact of no visitors really was immense for, I think, the patients, the families, but also for the staff. And I think roles changed, and I think it was very challenging and for all concerned. And I think the burden of that has not gone away. I think some staff found that sort of harrowing, that they say families weren't there, you know, sharing on the journey of the patient. And it was an added responsibility for the nurse, as well as dealing with so many other challenges at COVID time. I think initially as well, at the early stages of the surge, PPE was a huge concern, and it was coming randomly, and there was times when it looked like we were at risk of running out, and thankfully we never did. But personally, in my role, I was very concerned. You know, it was paramount that every healthcare worker that was going to be caring for COVID patients needed to be adequately protected and have the correct PPE. So that was really, you know, an important factor for me. And I suppose the biggest challenge that I couldn't have foreseen was the unique journey that this would present to everybody. There was times of isolation, times of loneliness for each person. And I can think of, if you think of a lot of our frontline healthcare workers in ICU, they're from Ireland, but they're from all over the world, really. They're from Europe, Asia, all parts of the world. And for them, I suppose it can be a very lonely journey, no matter where you're from, if you cannot connect with your family. If you've had to cancel your leave, if you haven't been able to keep in touch. And it's quite isolating for an ICU nurse, for example, to go in at the beginning of the shift and spend 12 hours alone in a room with a patient who you know is COVID positive, and you're it, other people come in and visit. And then maybe at the end of the shift, you know, you go home to an apartment by yourself, or other people are concerned, and you're concerned personally and professionally, what am I bringing home? So it has an impact. And really, especially at the early stages of this, you know, everybody else was doing their best to stay away from COVID, where you know, these frontline healthcare workers had to embrace and face it straight on. So there was many challenges, really.
And Áine, as you're talking there, as I said to Áine, we're now facing, or we're in the midst of a second wave of COVID-19. And I'm sure there's learning from your experience over the last 7-8 months that you can use yourself and your team for managing the evolving wave as it's happening. Could you talk to us about that? You know, what have you learned, and what will you be doing differently?
Well, I suppose the key thing is communication is key. You have to, and there was so much communication, so much messages, but you have to ensure that each member of your team feels involved, feels valued, understands what's going on and why certain decisions were made. And it's very much the power of collaboratively working together. So it's important to involve as many people as you feel is relevant into the decision making. And the voice of everybody within the team needs to be listened to, because everybody's perspective is really so valued. And as been referred to before, we were dealing with the unknown. So it's a matter of trying to figure it out and learn together. So I think really staff investment is priority, and really looking after staff welfare for me is a big priority, is a key learning.
Absolutely, Áine. And I suppose as we're talking about staff and we're talking about the management of the current situation, I'm just interested in the role of leadership, and I'm wondering, how did the role of leadership impact on critical care services within your hospital, and how is it impacting?
Well, for me, leadership is key, and I suppose we've really adopted a collaborative, compassionate leadership, whereby each person is valued and respected, and really having an open mindset. You know, we're dealing with the unknown. We have to think outside the box because of that. And I suppose by and respecting others, ultimately we want to empower and enable those at the bed space delivering the care, to ensure that everybody, you know, if you're a nurse and you feel part of the team and you know exactly what's going on, you know, you have such capabilities to deliver that care and compassion to that patient. So it's really important that everybody feels valued. And I think an agile approach to the leadership, it's important that we're always create a culture of learning and quality improvement. We're always trying to improve. And for, I suppose, for us having purpose-driven care that was aligned with the organisation and really with the HSE of their core values of care, compassion, trust and learning, really helped us deliver the care to the best of our abilities.
Áine, thank you so much for taking the time to present today. And it's actually fantastic to hear from somebody like yourself from critical care who's telling us of the experience that we have been hearing about, but to hear it from yourself is really excellent, and it'll be great for our listeners as well. Thank you, and I wish you the very best in the coming months as well.
Thank you.
I'm now going to hand over to my colleague, Dr. Clare Lewis, and Clare has been taking notes during the webinar, and she will present the key findings to date.
Thank you, Marie, and thank you to all of our speakers. I think you've all demonstrated, you know, how innovation has really flourished in these challenging times. In terms of Áine, it was really interesting to see how they distilled the evidence both internationally and nationally to actually mobilise services, and the level of senior leadership engagement and engagement with staff across the organisation in determining pathways for COVID and non-COVID care. And out of this came new ways of working, move towards virtual health and supporting patients at home. So creating capacity within the community to deliver services and respond to the needs of patients. And the infrastructure that was required to support staff on the ground. So visibility for senior nurses to be able to support staff on the ground, and how we support patients in terms of recovery. So using technology enabled care and also to have scheduled calls. I thought that was really interesting, and the importance of supporting staff and patients with health and well-being is essential. In terms of Kate, I think what was very clear is that compassionate leadership, not just for patients, but for colleagues as well. And having that adaptability and being able to prioritise care and collaboration across services that you may not necessarily have worked with before. But what's very clear is how the training prepared Kate for the role and synthesising the evidence into practice to deliver high quality care, even in these challenging times. But it was really, really, you know, it was wonderful to hear how she highlighted how rewarding the role is, to be able to be in a unique position to empower patients and families in their healthcare journey is a real privilege. And you know, obviously as a nurse myself, I'd encourage people to come into the profession, but using reflective practice to reflect on actually the situation that we're finding ourselves in, and has really helped Kate. And I think it's a wonderful way to share that knowledge and support people who are very, very new to the profession. So thank you for that, Kate. And thank you to Sinead. It was absolutely wonderful to hear Sláinte Care in action and the mobilisation of nursing services across the acute hospital to community, and what integration actually truly looked like, and the level of planning, logistics, infection control and prevention, because nurses were working in a completely different area. So having that clear pathway of communication, support for the environment, roles and responsibilities needs to be clearly defined, and using social media platforms to be able to share timely information. And it was one service, it wasn't two separate areas, it was one service. So there's a lot of learning from that we can take in delivering Sláinte Care. And just finally, Áine, it was wonderful to see, you know, we started with the patients, it was having clear purpose, so no critical care person would be left behind, and reimagining what care needed to look like and redesigning that, and looking at capability and capacity, and developing a surge plan that was a whole system approach. And that included the level of responsiveness that was required to scale up quickly, and the level of collaboration that was required within that, and also the training and education and how they delivered that through virtual learning environments. But what was very clear is that importance of connectivity, not just for patients, but for staff to connect with families, and that level of collaboration that was very, very visible, and valuing the knowledge and skills of staff at all levels and having that agile approach to leadership was very clear. So I'd just like to thank our speakers today. They've really demonstrated, how dynamic the profession is, how engaging the profession is, and the impact it'll have on the future direction of nursing. Thank you so much.
Thank you, Claire, and I totally agree with you. I'd like to say well done to all of our panelists today for your excellent overviews and responses to the questions posed. And I think really Acute Services, you've really shown the huge amount of work and commitment and care that is being done in Acute Services. So thank you so much. Thank you all as well who have joined us today for this webinar, and I hope you've enjoyed it. Our next webinar will be our 6th webinar, and it's Nursing and Midwifery Clinical Leadership during COVID-19, sharing the learning from mental health services, and we will be circulating that on the 2nd of December 2020. Thank you.